Hello there. Welcome to Back to Health YouTube channel, Dr. Charlie Schuster. I'm going to be reviewing Secrets of the Hip Part 2. This is taking the pre-work that we did in getting the nervous system prep, and that's Secrets of the Hip and Knee module that is also on this channel. I urge you to, again, look at that if you haven't seen it, because that's very important to get the proper software running before we start to work on the hardware. And we want to make sure that we're wiring in good movements. So after I have done the pelvic neuromuscular re-education and activating the glutes, and you saw me do a cross crawl earlier, I'm going to now do a very awesome exercise for the hip that will bring into play all the little intricate muscles of the hip that help it move correctly. You see, our hip is a ball and socket joint. Yet in our society, we sit, we get up, we walk, some of us even run. See these movements? Some of us even run marathons. And those are the movements that that hip does. But it's really supposed to be able to do this, isn't it? So it's important that we think of that hip as a room, and it's a round room. It's a dome. And what we want to do is we want to find corners in that room. And in those corners, there are going to be cobwebs. We want to keep them clean. We want to keep those corners clean. Cobwebs come back, so we've got to keep them clean. This isn't a one-time thing. It's regular maintenance hygiene for the hips. And I really hate to see people have to have hip replacements later in life, because this wasn't ever taught or addressed. So I always, again, I talk about ankle mobility and hip mobility. I don't do much knee mobility. But if you take care of the ankles and the hip, the knee is going to be much better off. So I'm going to show you how we do this. If you get up to a wall, get parallel to the wall, like this, then almost anybody can do this. It may be a little awkward at first, but you lay back, and at the same time bring your legs up, and you're halfway there. Now you got to do is rotate a little bit, and you got your legs against the wall. So what I'm doing is I'm going to put my hands under my thigh, come out as far as I can, just like that. And you might notice that maybe one leg doesn't go as far as the other. Don't worry about that. By working one side, you're working the other, and your brain thinks you're going 10 degrees further than you really are. So if we give your brain an activity, a crossword puzzle to do, and we make it a little more difficult, and it just tries a little harder, it'll do better. And so we're going to go ahead and go as far as we can with both legs, and just sit there for a minute. It's important to have your hands under so that you don't get too aggressive too soon. You see me inching back up here a little bit, because before I go any further, and I could go a little bit further, but before I get too far, I'm going to go ahead and work on rotating my hips in and out. I'm going to do that 10 times. 2, 3, 4, 5, 6, 7, 8, 9, 10. And I actually felt a little more tightness in my left hip. I don't know if it's going as far as the other. I kind of feel like it isn't. It's tighter. I'm working all these little muscles in there, and I'm making my hip actually do something it doesn't have to do very often, but should. And so again, sanding down those corners in that round room. So I can go a little bit further now, maybe not much, and I'm going to hang out there for a minute, and I'm going to go ahead and do 10 more. 1, now it's really feeling. 2, 3, 4, 5, 6, 7, 8, 9, and 10. And I'm going to see if I can go just a little further. Really good. Now I'm going to hang out there for a minute. If I say a minute, 15 to 30 seconds is a really good stretch. I'm stretching out the hamstrings as I do this very nicely. it's a wonderful hamstring stretch. Most of us, even when we do hamstring stretches, we tend to just stretch the back side of the hamstring when we do our hamstring stretch, and we don't get this inner band of muscles that just gets so tight, again with our G medius or glute muscle, that stabilizes the pelvis always being off, and I'm going to blame sitting. That muscle right there is constantly working, and it's a terrible stabilizer of the pelvis, but it sure tries hard and never gets a break. So that is one of my favorite exercises for the hip. For those of you who have trouble getting in that position, another one that you can do, if you have it, I like to do these things at home, but if you have a chair and a TV, you can put your foot up on the chair, or this could be an ottoman, or if you can't get your foot this high, how about a footstool? You just use a footstool. And so you bring your knee up like this, and this is a little bit high, and ottoman's going to be lower. There's a footstool right underneath that on the right there. Excellent. Thank you. I'll take that. And so you can use any kind of a stool, like so, and this is going to be a lot better. And I can just sit like this. Now, from this position, I'm going to work that round room, keeping my foot flat on the ground. You'll see me get out just a little bit right there, work that hip. And I'm going to hang out right here for a minute or so because it's just really tight. I can watch Monday Night Football or anything doing this. So there's just no reason to be sitting. Again, I just always say, if you're sitting, you know, think about what you could be doing just to do the opposite of sitting. You know, you can always do mobility exercises for your hips. And I'm going to go all the way out just as far as I can there. And I'm really challenging that hip right now, which is great. It's a good hurt, it really is. And then we're going to go ahead and let that leg rest and come over to this one, like this. Same thing. Work the outer corners of the room there. Good. And kind of hold right there. Again, I'm playing around. You can see that. I'm just trying to get that hip ball and socket. This is not neurosurgery by any means. It's just a matter of working that hip out and loosening it, finding that area there that is getting a little hung up and working through it. So that just feels so good. And then another really good exercise for the hip is if you can get down like this right here. Now some people, because of their hip socket, it isn't a flexibility thing so much. Their hip socket is more shallow. Mine happens to be. That means I'm going to have a more unstable hip. I can go all the way down like this. It's not because I do this every day, really. But some people, it's just as helpful for them to be like this, right here. And they can sit in that position and just move around for the hip. If you can get into a deep squat, it is a nice thing because it also stretches the discs in the lumbar spine. And then after you've been in that position for about 20 to 30 seconds, you go forward onto your elbows and go in circles. This is a really awesome exercise for internal rotation of the hip. It's unbelievably good. And then once you go a different, again, I'm finding a little area right there. I'm just going to kind of hang out there for a second, probably 5 to 10 seconds. I'll just go back and forth, going left now in a big circle. Good. Once I've got that, I'm going to just slowly bring my knees down. This is a little more advanced. Still a really awesome exercise for those that can accomplish it, bring your hips down. And I felt a pop in my hip right there. And loosen up that hip in this position. Again, I'm just going to go in little circles now from this position right here. Good. Go the other way. And that's causing some discomfort in that lift hip, but it's not painful. It should not be painful. I want to emphasize that. Just go back to the basics, first part of this tape, if this causes any pain. And also let your physician know, chiropractor, physical therapist, and let them know that that's bothering you. When you're done with that, you should be able to lay down. And I didn't do it before and after, but you should be able to take your hip and have more motion now out like that. And I probably started about there. This is a hard one for me to do, but it's, you know, it's better. My left one's much better than it usually is. So it's just an immediate improvement. So that's what I want to talk to you about with hip mobility. The only other exercises, you know, we talked about this motion right here. Well, what about this one? Should be able to go like that, right? And I showed you one way to work it with the stool. Another way that we can do that is we can take, when we're in this position right here, remember this? We can come up like this, come over, come back. And this is a great way, and I have to kind of scoot out a little bit and let the butt kind of sit down in. And you can feel me stretching there, okay? And another, this is whatever's going to work for you. I encourage you to try different ways. This is good, but I get more out of it if I can do this. Just like this. Pull up. Some people do it like that. It's just easier for me to bring this arm through, grab the back of the knee, and put a lid on it and lay back. If you can't quite do it, a towel can be used to help. And then 15 seconds in that position, come up to this position right here. Kind of a yoga sit there, and then this is the beautiful thing about this. Once you get into this position, and I'm really feeling that over here, if I straighten up, it's a really nice stretch. And afterward, after about 15 seconds of this, I'm going to go over this way, right there. I'm going to find some more muscles that need a little loosening and attention. Then I'm going to come back over this way, and we're going to feel some really good stretches there. Now, you may feel it in the other hip. Great. As long as it's stretching, you're helping the other hip too. So we do that on both sides, and that's going to help what we call external rotation of the hip. So it's a great little warm-up, stretch rather. And I don't like the word warm-up because these stretches are actually more useful after getting our heart rate up, not before. So I will tend to do these after a run, and I like to do the neuromuscular re-education or software update to get my G-medius firing before a run. And if I do that, it makes all the difference for the hips and lower back. So I just wanted to go through the hip, secrets of the hip, more advanced. And again, anything we do for the hip should be good for the knee. If you have pain in the knee doing this, you have arthritic change in the knee, instability of the knee, then again, you want to consult with your physical therapist and or chiropractor, your physician, your trainer will have excellent ideas for you to go ahead and modify, because there isn't any reason we can't find some way to stretch a muscle regardless of whatever the disability might be. I always emphasize that. So thanks again. That concludes this session.